Hello, Amy. I'm Rene Barrientos, and I am currently a second year occupational therapy student here at UTRGV. I am actually very excited to learn a little bit more about your discipline, especially when it comes to dysphagia. Now, I wanted to introduce you a little bit about what occupational therapy does, just in case you don't know. And basically, we classify occupations not necessarily a job, but anything that a person finds meaningful in their daily lives. So it could be anywhere from running to jogging to sleeping to bathing to toileting, even playing volleyball, going to the gym. Anything the person finds meaningful in their life, we are there to help you get better after you go through a certain disease or condition. Now, we also consider eating an occupation, and that is exactly what I'm going to be sort of talking to you about today. More specifically, dysphagia, as we know that it is difficulty swallowing. Now, we also know that they could be caused by two reasons, or secondary to two reasons: neurological disorders or neurological damage. Now, when I mean neurological disorders, I am talking about specific disorders such as multiple sclerosis, muscular dystrophy, or Parkinson's disease, which brings tremors, as we know. And by neurological damage, I am talking about a stroke or a certain brain injury or a spinal cord injury. Now, in this video, I will be sure to go over you with the specific seating or positioning that a client should have while eating or while being in a wheelchair, the visual accommodations they can have while eating, some assistive devices or assistive equipment that a client can utilize regardless of the specific condition that they have in order to bring food towards their mouth so that they can engage in the occupation of eating. And I will also be sure to go over specific devices such as a plate guard, a rocker knife, a weighted spoon or fork, a nosy cup, and a non-slip mat, also known as a dike. Now, I was lucky enough to be conducting my level 1 rotations this week, and they were nice enough to lend me some equipment, so I will gladly share some videos just to give you a better visual. Now, they did have some of this equipment, although they did not have all of it. I will be showing you what I was able to get hands on, just so that you can get a better understanding and a better concept of how these adaptive equipments look like. So I'll go ahead and get started with some positioning, and we can move forward from there. Now, positioning is very important, especially for our clients and while them eating, because we don't want any hazards to happen. Like I said, it is a safety concern. So this will prevent, or appropriate positioning will prevent them from choking. You need to make sure that the neck is supported. The knees do need to be at 90 degrees flexion. You also need to make sure that their feet are on the floor or planted on the footrests in order for them to have that support. Now, you do want a natural alignment of the spine, and you do want a slight neutral pelvic tilt, which is slightly anterior pelvic tilt. And you do not want the pelvic to be in rotation or higher than the other, like a hitched hip or anything like that. So you need to make sure, once again, that the trunk is aligned and upright, that the head is upright and at midline, and that the lower extremities are in coherence with the upper extremities. Ways you can keep the client upright or in a straight seated position would be simply to give them verbal cues, such as telling them like, hey, like, let's remember to keep your back straight up. Or you could give them tactile cues, sort of like tapping them on their shoulders or on their chest to push back to keep that spine aligned. Or you can actually just sort of like strap them down by the chest, but remember, you want to let them be as independent as possible. But those are several methods that you could keep them upright. Now, we will be dealing with clients that do have some visual deficiencies, and once again, this comes as secondary to the neurological disorders that we will be intervening or treating with. And some of these clients will have visual neglect. Their line of vision will not be there, and that necessarily means that, for example, if I do this, some clients will not be able to see from here to here, or from here to here, depending on their visual neglect, like I said, or maybe they'll just see a little bit on their left side and then all of their right side. It all depends. And we can do this, or we can help them out by sort of arranging the plate in front of them and just serving the food on the side that they can see versus on the side that they cannot see. And to grade this, slowly but surely we'll be adding more and more food towards we could fill up the plate. And they could simply just see by turning their heads to the side, just so that they could be able to see the food themselves. But like I said at the very beginning, we would just serve them on one side of the plate that they can actually see. Now, another thing we can do is probably use contrasting colors. I had previously mentioned the non-slip mat, the Dyson mat, and that would be a perfect example. You could place the plate on top of that mat, and the client will be able to tell the difference between the actual table and the plate itself. Lastly, the place could be very lit. It could be bright so that the client could easily distinguish where the food is at, where the plate is at, where the utensils are at, etc. And that's pretty much it when it comes to the visual aspect of this. Now, we do have to remember that there are solutions to many problems, especially with these disorders. And we do have to remember that eating is an occupation, so it's something we will definitely be working on. And these ADs, or adaptive devices, or AEs, adaptive equipments, are necessary in order for the client to be more independent, because like I said, our main goal is always for them to be as independent as possible without having to rely on other people. And with these equipments, sooner or later somebody's going to have to take care of a client. So with these devices and these equipments, they will be able to eat independently and will make them feel better about themselves. Because believe it or not, a lot of these clients do go through depression. They do go through many problems, especially with their mental health. And this just gives them a little bit of hope. It's telling them like, hey, like I could actually do this without any help. The first device I'll be talking about will be the plate guard. Now, the plate guard is very cool because it's sort of like well, it's gonna be funny. It's a guard that covers the plate, if that makes sense. And this is mainly so that people won't be spilling their food more than anything. I'm going to go ahead and show you a video right now on what it looks like and how you would apply it to an actual plate. Now, as you can see, this plate guard is very easy to place. You simply just separate it from the plate, you get the edges once again, and then you snap it back on. Now, the plate guard is very important, especially with people that have CVAs. They do, or any type of muscle weakness in general, they do have decreased range of motion, so their spoon could be, or not their spoon, but their food could easily be spilling all over the place. And they also have weakness, so at any time they could just collapse. Now, this one's something similar. It's called a lip plate, and like I said, it prevents food from falling off the plate, and it could also be used as a barrier to push food against when scooping up the food into the specific utensil into the client's mouth. Next, I will be talking about a rocker knife, and that is something that the place where I was at did not have, so I guess I'm just going to visually have to show you, or not visually, but verbally tell you how it works. It's basically, I like to think about it like a little pendulum, and it requires less fine motor skills and more gross motor skills. So somebody that might have as much strength, or muscle strength at least, could also use it. And it's basically like a little handle. You hold it like this on top, and then it's placed right here, and right here it's like a little hook. So let's pretend that the bottom of my finger is just a knife, and it just rocks back and forth, and you sort of just push it down so that it could cut whatever you're trying to cut. Right now I'll go ahead and show you a picture, but I'm sorry I wasn't able to get a video. So once again, this rocker knife is used to those that are unable to use a knife and a fork at the same time, like I said, because it requires a lot of fine motor skills and a lot of muscle strength and endurance, and this makes it just a little bit easier. Now, it does cut with a rocking motion, so it does sort of go like a pendulum, and it's specifically designed with people with this condition. It is very simple to use, and it's just T-shaped like I previously said. Now, also notice in the picture how the hand is being grabbed differently. It's being grabbed more like with an open grasp rather than a close grasp. So that would be very important as well to take into consideration. I will not be talking about weighted utensils, which include knives, spoons, and forks. And basically, this is seen in clients that have Parkinson's disease, since they do have tremors. The weight of the utensil helps the hand from shaking as much. Also, if a client has trouble grasping a spoon or a knife like this will require a cylindrical grasp, which will make it easier on the client, like I said, that doesn't have those fine motor skills. So what you're looking at right now would be the weighted fork. Like I said, if you notice my grasp, I'm using a cylindrical grasp, which is a lot more gross motor skills and less fine motor skills. And this would be considered the weighted knife. Now I did try to imitate some tremors, but obviously it doesn't look like that. I just tried my best. And like I previously said, it doesn't weigh that much. It probably weighs like a pound. Now I also didn't have access to a nosy cup, but I did manage to sort of make one for you. It's a Gatorade bottle, and as you can see right here, well, you can't really see because it's clear, but all of this is sort of cut out. Now it's a nosy cup. I'll show you a picture right now regardless, but this is used for the prevention of the client from extending their neck. So like I said, it prevents extension of the neck, and it also prevents the liquid from entering the wrong airway, which will eventually cause choking. So this is a better visual just so that you could get an idea of how it would look like in a real life situation. The Dyson mat, which they also didn't have, but I just like to think of it as a yoga mat. It's very, not that it's sticky, but there's a lot of grip to it. So the plates sort of tend to stay on it, sorry for that, and they don't move around as much. I'll go ahead and show you a picture once again. And like I said, it could be used for contrasting colors as well, in case they have some visual deficiency, and by they I mean our clients. So here's a visual just so you can see the Dyson mat. And like I said, it's a non-slip mat, and it's usually so that people with generalized weakness, or people that, or not people, but clients that cannot really have all that coordination there, it prevents the plates or the cups from spilling over, if that makes sense. And people with motor deficiency, especially in the upper extremities, get a lot of use for them. This is just one way the mat could be used. Of course, there's a lot of different other ways that we can use them, but when it comes to eating, it is mainly for that, to keep the items gripped in place. I'm going to show you a little video of all the different equipment that the facility had, because I thought it was very interesting. That I'm not really going to talk about it, but if you find one of them interesting, just go ahead and let me know, okay? That pretty much concludes my presentation on my behalf. If you have any questions, you already have my email, so please feel free to email me. And I look forward to seeing your video. Thank you.